I'm Bruno Paiva from the University of Navarra in Pamplona, Spain. I'm here at the IMS meeting in Athens, Greece, and I just talked about immune profiling and cellular therapies. These are exciting times. We finally have different, highly effective immune therapies against different antigens, BCMA, GPRC5D, and others that will follow, and different formats, CAR T cells, bispecific antibodies. And obviously, because of the mode of action of these new immunotherapies, there is great interest in immune profiling, having a better understanding of the patient immune status prior, during, and after these therapies to understand whose patients are benefiting the most from these therapies, whose patients are not, and how we can optimize. And I think that the current data is showing that yes, there is an association between how the patient immune status is and what the response to these drugs will be, the efficacy, and there is also evidence that immune dysfunction in patients with myeloma probably starts much earlier than the time of active disease. And this should make us think about on how to optimize the efficacy of immune therapies. And I'm thinking particularly on CAR T cells. And this could go two directions. First, bringing these assets early on to the first lines of therapy once, but secondly, why not to consider harvesting T cells when these are still fit in patients in whom we know, despite having a precursor condition, so not fully active disease, the chances of progression are higher, and therefore to have those cells in the bank, in the biobank, for the deployment of cellular therapies later on, and having those T cells in a greater shape, in a better fitness. That is still hypothetical, but it is our role, and we are very thankful to patients and the donation of samples. It is our role to have a better understanding, continue accumulating data to improve the efficacy of immune therapies for patients with myeloma.